Embryos created through IVF can now be genetically tested to assess whether they contain normal DNA. This is called PGT, pre-implantation genetic testing. To achieve a DNA sample for testing, embryos are cultured to the expanded blastocyst stage. A laser biopsy is taken from cells of the trophectoderm, the outer layer of the embryo, destined to become the future placenta. The biopsy specimen consists of approximately 5 cells, which are sent for DNA extraction and analysis using genetic technologies. Results normally take several weeks to return. Tested embryos are frozen while we wait. There are some downsides to genetic testing of embryos. Some embryos may be lost due to complications of embryo biopsy and freezing. 95% of embryos survive genetic testing. There are 3 types of PGT. PGT can be used electively to check a patient's embryos are normal in terms of the number of chromosomes they carry. This type of testing is PGT-A, testing for chromosomal aneuploidy. Chromosomal aneuploidy is common in embryos of older parents due to random errors that occur in embryos created from age-compromised eggs. PGT in some circumstances can reduce a person's risk of miscarriage and reduce the number of embryo transfer attempts needed to conceive a healthy pregnancy. The cost of PGT-A is fully patient-funded with no applicable Medicare rebates. Genetic testing of embryos provides you and your specialist with more information about your embryos, but it does not change their genetic makeup. Genetic testing of embryos is a selection tool. While it may avoid miscarriage or conception of a baby with a genetic condition, PGT cannot result in a higher live birth rate in IVF compared to serial transfer of available untested embryos created in an IVF treatment. PGT can also be used to test for known inherited monogenic diseases and structural chromosome rearrangements. Some diseases can be genetically inherited. Testing embryos for a specific monogenic genetic condition is called PGT-M. PGT can also be used to test for structural chromosomal rearrangements inherited from a parent, known as a chromosomal translocation or inversion. Testing for this is called PGT-SR. Chromosome structural rearrangements can cause infertility and recurrent miscarriages. We need to do a special pre-treatment DNA parental assessment called a karyotype to discover if this problem is present in a parent. Medicare rebates for genetic pathology can now apply for PGT-M and PGT-SR for both pre-test laboratory workup and genetic testing of embryos during treatment. Genetic testing of an embryo doesn't guarantee a future healthy pregnancy. There are many important steps between being a blastocyst, a fetus, and a baby. Many mistakes that result in failed implantation and miscarriage are not genetic, but occur for other reasons. For example, developmental, structural, immunological, or metabolic errors. Before choosing to have PGT, test accuracy will be explained to you. There is a small chance with embryo testing of false positives and false negative results. This is due to the fact that only a small sample of the embryo's total cells can be tested. Some embryos can be mosaic, meaning they are made up of a mixture of normal and abnormal cells. The cells we test come from the outer layer of the embryo that will ultimately form the baby's placenta. The cells that will make the baby itself are located in the embryo's inner cell mass and have not been tested. We sometimes detect mosaic embryos through PGT. A mosaic embryo may be offered for transfer if we think the embryo still has a reasonable chance of becoming a completely normal baby. We are aware from studies of mosaic embryos offered for transfer that the birth of a normal baby may still be possible. Genetic testing of embryos is complicated. We encourage you to write down any unanswered questions that occur to you, and we can address these together.